I run virtual classrooms a lot because the program is completely external. I do a lot of revision sessions in the evening, just so that I get that sort of synchronous connectivity with the students, and then I can provide immediate feedback and things like that. It's a flipped classroom format, so I give them case studies right at the start of the semester, and then resources are provided. They complete their quizzes, summative quizzes, and then so hopefully they come prepared for the discussion. Chart here is the research skills development framework. And what you all are doing in level 2 courses is that we want you all to achieve this level. So people starting off in physics and professional issues will start off with level 1. Apto superficial parts will develop level 2 research skills, and then so on. And people doing master's electives will go on to level 4 and level 5. And PhDs and all those will go to level 6 and 7. And then using a case study example, and I also used the different affective facets as well, and then started picking on case study elements within the actual case study. This whole rubric is actually, the marking rubric which you have is represented in this little pentagon. Okay, so what we'll do is we'll use this pentagon to try and problem solve. Now let's use this question and apply the research skills development framework here. So the main focus of diagnosis or anything in healthcare basically is patient-centered care. So to start off with, basically, then to know what a patient, what's the best way to work with them, you have to identify patient needs, right? So it's a good place to start with empathy. Yes, exactly. So is the patient in pain? Is the patient worried? Is the patient looking anxious? All those sort of things. So in the rubric, it says sonographer trainee embarks on research to clarify the following: provide background information, choose an approach to a scan relevant to the given scenario, and obtain history relevant. So all that in the marking rubric is pretty much what you've done here. Okay. And also, in the rubric, the next bit is find and generate, is how meticulously you're approaching this whole thing to come to a diagnosis pretty much. So that also involves knowing your theory. You need to know whatever. It's not enough to just have clinical and technical skills. You need to have the knowledge there as well, which is what you will develop as you go along. Then what will you do? Once you've got a plan, so it's pretty much you're forming a plan in your head before you actually touch the patient. So the next bit here is about evaluation and reflection. So this is where you will actually start gathering all your information, and you perform your scan, and then it's all about ethical standards and professional standards. And sometimes, there's a lot of information which is coming through, and you may get a bit confused. So always, whenever in doubt, go back to the center, find out what the patient came for really, and then try and approach. So every time come back to the center if you get lost anywhere. So then you start organizing and managing all the data you've gathered. Try to order your ideas, prioritize, and in your own head, you have to make sense of the whole picture. So look at what information was given to you in the beginning, what information you found with your own scan, and trying to put everything together. Image documentation, I would think, will come in organize and manage, Lakshmi. It will come in here because you're pretty much managing your data here. So you're, but it could also be, you're evaluating the images as well. So it's not very, there will be some overlap, but these are all the aspects of the whole research rubric. Once you have got all your images, got your data, put everything together, then you'll analyze, and then based on all your readings you've done before, or the protocols you've come across, and everything, you will put everything together and you'll synthesize all this information. So this is where you're creating knowledge, or in fact creating a diagnosis. Then the next question comes, how are you going to summarize it? And that comes in communication and apply. So how are you going to present it in your worksheet? How are you going to present it to the patient? Explain this
explain your findings to the supervisor or radiologist? How will you communicate with the family, and so on and so forth? And how will you take it further if they need to be referred off to the GP? Okay, so that's the whole idea behind this whole framework. It's just a methodical way of working through diagnosis. And you can use this, you can remember this pentagon, and then you'll never forget a single step. Okay, if you keep practicing this sort of approach, then it'll become second nature.
I have now also given them an online presentation on all these aspects, and hopefully that gives them a bit more insight into what's expected of them using the RSD.